Hi everyone, thanks for joining me on another episode of DxTx. I'm your host Sahan Safi, and this week we're going to pick up where we started last week talking about ankle sprains, but more so, once you've been diagnosed with an ankle sprain, what are some things that you can do in order to manage your symptoms? Before we get started, I always ask that you guys remember to like, comment, and subscribe below. I really do appreciate reading your messages and your thoughts on all of our videos. So with regards to ankle sprains in particular, the treatment or the conservative treatment that we usually recommend is dictated by a mnemonic known as RICE. Now, the R for the RICE mnemonic represents restricted activity. Obviously, the go-to saying is rest, but when it comes to ankle sprains, what we recommend is using your pain as your guide. If you are able to walk relatively comfortably and you've been instructed that it's safe to do so by your healthcare provider, putting some weight on the ankle and using your pain as your guide, meaning if things are hurting too much, you don't do it. If you're able to do it comfortably, it's okay to continue doing it, is usually a safe bet when it comes to determining how mobile you should or should not be. The I in the RICE mnemonic stands for ice. The thought process behind ice is really related to the fact that we think that icing an injured joint or an inflamed area really helps to reduce inflammation. So what I always recommend is taking some ice, 15 minutes on, 15 minutes off. If you're able to do that, 3 to 4 times a day over the affected ankle, especially in the first 48 hours where the inflammatory cascade is the most pronounced, that is usually a safe bet. Now, some people always ask, well, heat feels better. Anytime I ice it, it feels terrible. And I'm a believer that you should use your symptoms as your guide, listen to your body. If you're icing it and it doesn't feel good and heat seems to work better for you, there's certainly not going to be any harm. Really, you should just be using your symptoms as your guide. So in the first 48 hours, ice is the recommendation, but if you find that you're at that 48-hour mark and ice really doesn't seem to be improving your symptoms, but as soon as you put a little bit of a heat pad on it, that seemed to work, that's totally safe to do so. Some people even find alternating between ice and heat works for them. So really, whatever works for you. Our recommendation in that initial 48 hours, again, is ice to help reduce inflammation from a pathophysiological perspective. But if something feels better for you, that's generally a good sign. The C in the RICE mnemonic stands for compression. Compression really used to refer to tensor bandages or ankle braces for extra support. There's a lot of mixed evidence about this these days, and there is some evidence to suggest that patients who tensor actually take sometimes even longer to recover. So again, this is one of those things that I really just say to the patient, if you're able to tolerate walking and doing activities without a tensor and it's not significantly swollen, you probably aren't going to get much benefit from applying a tensor wrap. But if a tensor might give you the difference in terms of allowing you to put a little bit more weight and giving you a little bit more mobility to help improve your mobility more quickly, then that's usually a good first step. The key thing when you apply a tensor bandage to an affected area is to make sure that it's not too tight. So if it's cutting off your blood flow, you need to adjust your tensor so to ensure that you're getting blood flow to the tip of your foot. And I always recommend taking a tensor off at nighttime because again, you get very, very stiff. Your joints like to move, they like to be active. And if you're applying a tensor for 8 hours while you sleep, a lot of the times patients will wake up in the morning and they'll be as stiff as a rock. They won't be able to put any weight on their ankle because it's just so stiff after using that tensor. So again, I always recommend taking that off at nighttime. And last but not least, the E in the RICE mnemonic stands for elevation, so keeping that leg elevated in order to help swelling. So if you're sleeping on the bed, we usually recommend putting a couple of pillows to prop your leg up and allow that blood flow to return to the heart and to help with your symptoms. Now, those are some of the mainstays of our recommendations when it comes to conservative management. Your healthcare providers will oftentimes also recommend pain medications, in particular anti-inflammatories. So if you're young, you don't have a history of ulcers or stomach problems, and you don't have kidney disease, a short course of anti-inflammatories like Advil, ibuprofen, or naproxen or Aleve is reasonable. Again, consult with your healthcare provider as well as your pharmacist to determine if that's right for you, and make sure that you're following the instructions on the bottle or on the prescriptions that you had in terms of taking them regularly. But those anti-inflammatory medications help to reduce the inflammation improve your pain and also hopefully help to improve your mobility. So a short course, sometimes 5 days to a week of some anti-inflammatories is not uncommon to see either. In addition to those medications, Tylenol or acetaminophen sometimes is also recommended. These medications work differently. A lot of the times patients are surprised to hear that you can take Tylenol and Advil together. But again, we do this from time to time to help provide even further pain relief for our patients. Obviously, if you have a really bad ankle sprain and you're having trouble walking, sometimes we will even cast our ankle sprains or provide our patients with walking boots. If that's the case, you'll oftentimes probably be getting some follow-up in order to make sure that you're improving dramatically. And in those scenarios, we also will provide patients with crutches to help with their mobility. And usually with the crutches, what we'll recommend, if you aren't in a walking boot or if you're able to actually bear weight partially, we'll say, use the crutches to help offset some of the weight that you're putting on your ankle. But if you can walk with semi-weight bearing or putting a little bit of the weight on the ankle, that's also okay to do so. Okay, so that wraps it up for this week's episode on the treatment of ankle sprains and the conservative treatments, some of the common things that we talk about. Remember, if you're worried about a sprain or a fracture, make sure you've seen your healthcare providers to make that diagnosis. And when it comes to some of the common recommendations for conservative therapy, we recommend the RICE model: restricted activity, ice, compression, elevation. If it's a bad sprain, sometimes you might be fitted with a boot or a cast or crutches. I hope that this episode was useful for you. As always, please remember to like, comment, and subscribe below, and I look forward to seeing you guys next time. Take care.